older people to have a sense of well-being remaining in their homes, in their community, they need a lot more than just assistance with some of those basic tasks.
Since the beginning of the COVID and even beforehand, we were seeing mass amounts of these home care workers, these long-term care workers leaving the field.
Very simple things like handrails on all of the staircases. I think the point that we want to make is we want to avoid falls.
We have to rethink the whole system. To me, the worst thing that could happen out of COVID is we just build more beds.
From the Zoomerplex in historic Liberty Village, the Zoomer with Libby Znaimer.
Welcome to the Zoomer. I'm Libby Znaimer. The pandemic has highlighted the crisis in our long-term care system. The toll in the first wave was catastrophic. 80% of COVID deaths were in long-term care, the highest percentage among Western nations. And despite government promises to take action, the devastation continues in the second wave. So it's no surprise that now, more than ever, Canadians want to be able to live out their final years at home. For many, that will require some level of care, whether from a relative, a professional, or both. Today, we'll find out how home care can be the solution to the long-term care crisis. First, let's tee up the topic.
As COVID-19 spreads, Canadians find there's no place like home. According to a new study, over 90% want to stay in their home as long as possible. Meanwhile, 95% say it's the safest place to be during a pandemic. But a lack of funds means home care may not be possible for everyone. In a recent CARP survey, nearly 70% weren't confident that they would receive adequate home care supports. But with 4 out of 5 COVID-19 deaths in Canada linked to long-term care, it's more critical than ever for governments to invest in care at home.
In recent years, the age of long-term care residents has increased while their health, on average, has deteriorated. 70% suffer from dementia. This has coincided with pressure to cut costs. And while everyone knows that home care is much cheaper than hospital stays, a huge number of patients are in hospital long-term because they can't get access to nursing homes or home care. It's the proverbial catch-22. David Cravat.
Thank you, Libby. It's a catch-22, and it's even worse now because the Auditor General in Ontario included retirement homes in her recent assessment and found 4,000 people in retirement homes who had been sent there from hospitals with medical conditions that would justify long-term care homes for which there is no bed. So they moved them from the hospital into a retirement home now. And guess who's in charge of that? Doesn't seem to be anybody.
Bill Reichman, I know you've been talking about this for a long time. Here in Ontario, the government keeps talking about how they're building tens of thousands of more beds, and you believe that is not the solution.
That's correct, Libby. It may be a small part of the solution, but we have to start by redefining here in Ontario, and in fact across North America, what long-term care even means. We've had a remarkably narrow concept of what long-term care is, and it essentially equates to nursing home. So if you need long-term care, you need nursing home. This has to change. If you need long-term care, you should be able to access a whole variety of different solutions that are well matched to your particular needs at the right time, the right place, and at the right cost.
Miranda Ferrier, one of the things, the problems that the government keeps pointing to is a shortage of long-term care workers. And we know the pay is lousy, the conditions are not great, and there are no benefits.
That has been the story now going for over a decade, Libby, where we do not have enough personal support workers. Since the beginning of the COVID and even beforehand, we were seeing mass amounts of these home care workers, these long-term care workers leaving the field.
And how has COVID accelerated that? I keep hearing about many workers just not coming back.
Yeah, well, with the first wave, Libby, one of the home care companies I deal with all the time told me they lost about 50% of their workforce. And since the second wave has begun, they've only gotten back about 22% of that workforce. So that's really damaging, not only to the company, but imagine these clients that are not receiving the care that they need. We have tons of Ontarians right now that are crying out for help, and we can't get to them.
Susan Roper, I'd like you to share your story with us because you were caring for your husband and you would have continued to care for him at home, but you couldn't get enough support.
That's correct. I did have support and the workers that I had were very good. The concern is that number one, consistency of hours. The other problem is that they were only really in 1 hour blocks because that's what most of the workers do. So to get somebody for a 2 hour block, you would get somebody who hadn't been there before. So then you're explaining to them every time what needs to be done, how things have to work. And that cuts into the actual time that you have, the 2 hour slot.
Let's just backtrack a little bit. Tell me about your husband. What was his condition and what did you really need to be able to stay at home?
My husband was diagnosed with Alzheimer's almost 10 years ago. So we started with PSW care about 2.5 years ago. And first of all, I got 1 hour a week. I basically said to her, phoned her one day and I said, I want you to come to my house. I said, and I want you to, sounds disgusting, realize the smell that's going on in my house because my husband wouldn't shower. So she gave me 1 hour or 1 hour a week for somebody to come in the morning and shower him. And basically that was it. But then as soon as she gave me the hour, I said, how do I get more? And I just kept bugging her. I will admit the second social worker that I had was absolutely fabulous. And she gave me the maximum hours that I could have, which was 25 hours a week, which sounds like a lot, but it's not really.
And how long were you able to manage with that?
We had that. My husband went into a nursing home in January of this year. So that was what we had. But it got worse and worse as time went on and as his disease, progressed. And he was in diapers before. He has been in diapers since a year ago, September. So I found that was extremely difficult for me to do. He was very restless at night, even though he was on medication. He just wouldn't sleep, which means that I wasn't sleeping as well. And I was very upset when I had to put him into a home. He's in the best place now because he's got 24-hour care.
Would you have kept him longer if you had more care?
I would have, yes. If I had had more care, I would have.
Okay, Andre Picard, this is not a new story for you.
What you're hearing is the typical story is we keep people at home until their caregivers burn out, and then we put them in an institution, and often in a panic situation where they don't get a choice, they don't go where they want to go, the person is not ready, they're not primed for it. So it's an issue of getting, as you heard earlier, getting people in the right place at the right time and making it affordable, making it livable. And we have to rethink the whole system. To me, the worst thing that could happen out of COVID is we just build more beds. We spend a lot of money now on bad care, and we just don't need to spend a little bit more money on more bad care. We need to spend money differently and get better care.
You've just said something that puts a whole new spin on it for me, and that is that the tipping point, the turning point to putting someone in care seems to be not the lack of hours necessarily or the person's condition, but the caregiver burnout.
Yeah, and the caregiver burnout is, of course, linked to the lack of hours often, because you just, as you hear, especially, I've had parents with dementia, they're up all night, you just get exhausted, you get burned out, you can't work anymore. So you just get to the end of your rope and you just say, I can't do it anymore. And then it's not the fault of the caregivers. Caregivers give way more than they should have. They make themselves literally sick before they say, well, I guess my loved one will have to go to care. We have to have homes for some people, but it should be the last resort. It shouldn't be the default position, which it is now.
Yeah, no, I certainly wasn't suggesting that it's the fault of the caregivers, but I'm saying if that is the inflection point, then we should be able to fix that. Bill Van Gorder, none of this is a surprise for you either.
No, this is not. Our CARP surveys have shown, first of all, that over 90% of people would rather stay in their own homes. And CIHI, the Canadian Institute of Health Research, says that 1 in 9 of the residents in long-term care could be better cared for at home. Our research and others shows that that could even be as much as 20%. And they said that in-care home care provides a better experience and better care for these patients.
Okay. When we come back, how to make aging in place a priority. That's next.
We just need the provinces to sit down at a table and agree on things. And we need Ottawa, when they transfer money, to attach strings to it and then to follow up.
We know that aging in place is better for seniors' mental and clearly physical health. It also makes economic sense. So is there the political will to make aging in place a priority for those who don't want a large facility-based long-term care home? I spoke to Federal Minister of Seniors, Deb Schultz, recently about home care. Ultimately, the solution to this is home care, and there just isn't enough. The Ontario government announced a small project that looks quite innovative, sending people with complex needs home from hospitals where they can get up to 11 hours of care. What is the federal government planning to do to help with that?
So Libby, what we did do is that we provided $6 billion to provinces and territories for improved home care and mental health. So we are providing more support to the provinces and territories so that they can provide better home care for Canadians. And so that's the kind of work that we've been doing to help provinces and territories with home care.
It sounds like a lot, but it isn't enough, even though when you look at home care, it's a lot cheaper than the hospital.
I totally agree that it is a better solution for Canadians, not all Canadians, but many Canadians. It's a better solution, but we have been working not just in providing money to provinces and territories, but you saw in the fall economic statement that we've been looking at ways to help Canadians stay in their home, so that maybe not just the home care part of it, but other elements that seniors need to be able to stay in their homes. So these are all things that are going to help Canadians stay home and get the care that they need and the support that they need.
Recent polls show that the experience of COVID is making people decide that they just want to do everything to avoid ever having to go into long-term care.
Well, you're right, Libby. We were hearing this even before the pandemic. People really would prefer to stay in their homes. So this is the focus of the federal government now, is how can we better help Canadians stay in their homes so that they don't have to go into long-term care until it's absolutely necessary.
Governments have made promises to spend more, recruit more, improve standards of long-term care, and Ottawa even says it will push for national standards, but it always seems to come down to the old spiel about not treading on provincial jurisdiction. So is that the main obstacle to creating a viable home care system in Canada? Andre?
It's not the main obstacle. It's certainly one. It's an excuse to not do anything. We don't need a federal program. Grand program. We just need the provinces to sit down at a table and agree on things. And we need Ottawa, when they transfer money, to attach strings to it and then to follow up. So it's true, you heard the minister said a lot of money has been spent on home care, but it's not being spent on keeping elders in their home. It's being spent as an extension of hospitals. So you get surgery, you get sent home right away, and you get home care for a couple of days. That's just spending more money on hospitals, and that's not what we need to do. We need to spend money on keeping people in the community, and that's a very different issue.
Bill Reichman, what's your view of this?
I think the definition of home care also is too narrow. We tend to think of it only in terms of somebody coming into the house for a few hours, perhaps a day or a week, to help with things like bathing or dressing or eating. But in fact, for older people to have a sense of well-being, remaining in their homes, in their community, they need a lot more than just assistance with some of those basic tasks. They need companionship, they need social connection, they need recreational activities. And so while I understand that many people think that they desire to stay home in their community, sometimes staying home in their community can also be staying home alone. So as we build a new version of home care, it needs to extend beyond just meeting people's basic care needs and needs to address what all of us human beings need in order to have a sense of purpose, inspiration, and fulfillment.
David, you're nodding your head.
I completely agree with what Bill said, because when you look at it, you've got to start with recognizing that this is a continuum. That if you could stay healthy and live at home just fine and never need any help, well, that's your baseline. Now you need help. What kind of help? Is it activities of daily living? Is it a little bit of assistance, somebody to drive you to your shopping? No, it needs a little bit more than that, a little bit more than that. Now maybe the home is too big and you go into a retirement home. Now you need a little bit more help. It's a continuum, and it needs to be looked at from the user's point of view first. It's a jumble of competing silos right now, and so they're not getting a whole look at the whole thing. And until they look at the whole thing as an integrated continuum, we're going to have these piecemeal solutions, and as Andre said, we're going to pay more for bad care.
Miranda, where would PSWs fit into this expanded definition of what home care is?
Everywhere, I think, is the easiest answer on that point. I mean, you can't provide home care without a personal support worker. I mean, there's different names for us in different provinces across our wonderful nation, but at the end of the day, it's a PSW that goes into these homes to assist individuals with their activities of daily living. Now, going back to fixing the system, as we were just talking about, we need to start looking at this from the ground up, instead of always looking at fixing this healthcare system from the, from the top down. Recently I had a conversation with our federal minister, and I also discussed about how we need to start looking at care teams. How do we approach this? Because everything centered around the client or the patient or the resident, whatever we want to call it, we need to have it all centered around it so that we can provide the proper care. But if we keep looking at it from a money or silo aspect, we're not going to get anything done.
Bill Van Gorder.
First of all, seniors are tired of being the ball in the ping pong game between the levels of government. That has to stop. There has to be cooperation. Secondly, seniors need decisions made with them, not for them.
Susan, could a more holistic approach that maybe would have included day programs or recreation or something like that, would that have helped you keep your husband at home?
It would have. That would have been really great. And when I first started with the personal support workers, I asked, we live 5 minutes away from a huge community center, and I asked if they could take my husband there, and they're not allowed, apparently. The other thing I found that unless I said to the PSWs when they came, this is what he likes to do. Don't sit him down in front of the TV and sit and watch TV with him. I mean, he would do that by himself. Play cards, play games, do puzzles and things with him. Some of them were, oh, you want me to do that? You don't want me to just sit here beside him while he watches TV? No. I mean, that's not stimulation. That's not helping him or anything.
Okay. When we come back, finding and accessing home care services, that's next.
They make it so hard for them to find out that information or to receive that public, free public care, that a lot of people just give up.
Welcome back. We all agree home care makes better health and economic sense than relying on long-term care facilities, and it's what people want. So, what services currently are available as part of the public health system, and how do you get at them? Miranda.
It's like opening Pandora's box because there's so many different aspects to home care. We have home care that is available. It's public home care. It's available through the local health integration networks, or Ontario Works, whichever you want to call it, Ontario Health. We also have private home care where you can actually hire a personal support worker directly through an agency and pay out of your own pocket. Then you have day programs, which many are unfortunately not operating right now because of COVID. I mean, I could go on and on. There is a lot of of information out there, but there's no centralized place for people to find this information. That's one thing we find here at the association, are so many phone calls, so many emails from families that are looking to know what their options are when it comes to home care. And I think that they make it so hard for them to find out that information or to receive that public, free public care, that a lot of people just give up.
Bill Van Gorder, I think you have a lot of experience of that.
Yes, we certainly have. And it's so difficult for our members to discover and find out what services are available. One of the things that we have been talking to governments about is being more open in terms of all the services that are available. Many governments and government employees are very cautious about talking about for-profit services that are available and would only talk about the non-profit ones that are available to citizens. And that's not going to help the situation. This is a growing area where it's being serviced by for-profit companies offering very good services at all levels of the care. We need to have navigators that are able to point people in the right direction.
Andre, so how much of this type of service should be funded publicly?
Well, that's a policy decision we have to make. Now it's we're not clear how much is publicly funded. I think the issue you heard about is the really important one. Information's hard to come by. I hear increasingly families hiring consultants to help them figure out what they can get from the public system. That's perverse. It shouldn't be like that. It should be easy to access. Then we have to decide. But I think that's a much broader discussion in Medicare. It's one of the big flaws in our public policy is what is publicly funded and what is privately funded. There's a lot of blurred lines there, and we have to make those tough decisions. It's not a question, we can't fund 100% of everything publicly all the time, but we have to make the system fit together, and we have to ensure that nobody's denied essential care.
I mean, if you're going to pay for it yourself, it costs a fortune. From personal experience, and this is 12 years ago when I was ill and I needed a lot of support at home for about a month, and it was in 1 month, it was $10,000.
Yeah, and that's not uncommon, $7,000, $10,000, $15,000. And imagine if you have someone like my father who lived with dementia for 10 years. That's just not possible for families to put up with, regardless of what the care setting is. So we have to find a way to support people, to use their tax dollars wisely, whether, not exclusively on hospital care, but on home care and people, in keeping them in subsidized housing. There's all kinds of ways of helping people out, and it shouldn't be limited to stick them in an institution with 4 people in a room.
David, I mean, navigation, I think, is the word we're looking for. It's extremely hard to navigate.
It's very hard to navigate, but I think one of the things that comes out of these comments, which I completely agree with, we are underestimating the degree to which this topic is going to explode. I've read certain financial planners who are talking about the caring economy, where just the size of the people caring for other people is going to be an economy of its own, 37% of the economy, some people predict. We should be having, and CARP is encouraging its members to do this, to start to put together a long-term care plan for yourself and your parents that starts with the home, and then branches out, begins to identify resources ahead of time, keeps up to date with what's going on, so that when you need it, you're ready, and you're not scrambling around at the last minute like so many people unfortunately are today.
Bill Reichman, at Baycrest, how do you handle that continuum?
So, I think that we do recognize that some services are the obligation of the public sector to fund, and we ensure that families are connected to those resources. We have other services where families have to pay out of pocket. There are some government programs where the out-of-pocket payment is means tested, so there's additional government support. And what we have found clearly is that the care coordination or the navigation is critically important, because the access to services right now is very confusing for families. It's very fragmented, and who pays for what is also largely elusive to most people in the community.
Susan, how would a better navigation system have helped you?
It would have been great. The social workers don't always seem to know what's available in your particular area. I live in Scarborough, and I had one social worker tell me that someone would actually come to my house and take my husband out, 2 different programs. That's not available in Scarborough. It's available in Etobicoke and in Mississauga, but it's not available in Scarborough.
And quite frankly, what's available in Etobicoke should also be available in Scarborough.
Yeah.
Navigating government websites can be a nightmare, but there are businesses that help find nearby services, costing them out and connecting community members to share resources and personnel. Let's hear from Home Care Hub before we take a short break.
With Home Care Hub, there's a few key areas we're trying to address. One is around improving the quality of home care. And then the second part was around cost. It's just really expensive to try to care for someone in a 24/7 manner. I see so many acute patients as a hospitalist that patients, they require significant care, and there has to be sort of new creative ways to do that.
My name is Donna Fowler. I was in the nursing field. Donna's
a patient who lives at home, has challenges with her mobility and other ADLs and day-to-day performing day-to-day skills. So Donna reached out to us for extra care beyond what she can get from the local health integration network or the government.
With the seniors, we have a senior group. We do it by phone, telephone. So it's conversation with them. We play games, do quizzes and various other things.
And with our share care solution, that really focuses on bringing down the cost of home care and as well tackling that social isolation. So we're taking people who live in the same neighborhood and connecting them, and then really creating a shared living or a shared program solution. So 4 or 5 people living together instead of a nursing home, and we provide all the nursing home services in that, and it feels much more home-like. Or them going for programming at somebody's house 8 hours a day, and we've created a technology and other operational service around that so we can really expand this across the country.
Falls is really what the essence of some of the bigger issues are with home modification. If we can avoid the fall, the majority of seniors will not then end up in hospital and not end up in care.
Welcome back. Getting ready for aging in place requires a multi-decade care plan, whether it's for yourself or your parents. What's required for the eventuality of needing in-home help? We're joined now by an occupational therapist who works with families on creating aging-in-place roadmaps. Lesha Dyke, hi. When should we start planning this?
That's a very good question. I think I can tell you from my own experience, my husband had surgery, and he was very, very thankful that I was geeky enough to install all these things into our own bathroom in order for him to have a really easy rehabilitation. So I think that one of the things that I like to make a point of is you can't plan your fire escape when your house is under flames. And often the guests have made points that it's a crisis situation in the home and you're just trying to live day to day and trying to get the basics done. But if there was some thought given to how the environment supports the things that you want to do, it would make things so much easier as you age, and certainly wouldn't come to a crisis situation.
Given that we don't know what types of ailments or frailties we're going to suffer from, what are the kinds of things that you can actually do in advance?
I think that there's a lot of options now that, for example, right height toilets, people are installing them now as a matter of course, so it's easier to get on and off the toilet. Making the showers step in or very low threshold, so you're not having to step over something very high. It's very simple things like handrails on all of the staircases. I think the point that we want to make is we want to avoid falls, because falls is really what the essence of some of the bigger issues are with home modification. If we can avoid the fall, the majority of seniors will not then end up in hospital and not end up in care.
Miranda, what do your PSWs observe that are mostly missing from people's places?
When they are in people's homes, helping them with their activities of daily living, one of the things that we do all the time is helping them shower or toilet. If you don't have room in between the vanity and the toilet for the PSW to get in, either with a mechanical lift, if that happens to be in the home, a lot of times it's ceiling lifts that we see in these homes instead of, the ones we wheel around. If there's not enough room for a PSW to get in there, it becomes very dangerous. And I totally agree with the last speaker about, falls are what do send the majority of residents into long-term care homes and retirement homes. It's a real problem.
Bill Reichman, at Baycrest, it seems that you have a roadmap to get through the continuum of care. How does it work?
We first get a comprehensive understanding of what is this person's needs and desires, what's their life story, and what kind of life do they aspire to for the next chapter. And so we customize the care plan, and then we guide the family as to what kind of setting might best meet their needs. And that can be 24/7 help at home in the community, or it could be admission to a long-term care facility, or depending on the family's interests and their financial capabilities, it could be moving into a retirement home, which is largely private pay. So it's very much a customized approach with a whole host of options for families to then select. And of course, they're given guidance as to what we believe, based on our experience, might best meet their needs.
Ontario has a Healthy Homes Renovation Tax Credit, a refundable tax credit for up to $10,000 in improvements to make a home safer and more accessible to seniors. We spoke earlier to Peter Haché, a certified aging in place specialist, about the most practical renos to undertake.
Contractors have the right product knowledge and information, they can transform a home that is a safer environment for the residents and the caregivers, and very aesthetically pleasing. It has a lot to do with bathrooms and stairs, and the reason for that is we try to focus on what is the largest impact in the home from a safety perspective, or enabling somebody to age in their home as long as they choose. This is really all about fall prevention. When you get into accessibility, it's different because accessibility needs to make sure that the client can function. Things are lower, countertops are higher so that chairs can get under. When we're servicing clients that are 83 years old and they have no intentions of leaving their home to live in a retirement facility, so they want to extend their stay in their home as long as possible or as long as they choose, being able to allow that to happen through home renovations, when you see how happy they are and the fact that they now acknowledge that they have a safer environment, is certainly fulfilling. And it's something that we actually love to do, and it's meaningful to us.
We have smart mattresses, smart flooring that tells us whether there's been a change in someone's gait or in their overall movement.
Well, on the positive side, smartphone use is growing among older adults, and so they have the ability to use smartphones to connect with other people. They're getting larger and what have you. But I think the most interesting trend that is specifically going to benefit older people is the introduction of what is called voice first. And the voice first technology market includes, but is not limited to, smart speakers, which have been around now for a couple of years. 2016, really, they took off. And smart speakers enable you to actually if you have a high-speed internet connection, you can play music, you can listen to books, you can get information about a question you might have, whether it's about medical care or disease. You can use a symptom checker. But you can do all these things by using your voice, which turns out to be one of the features as we age that is most comfortable for us. It's one that we've been best at, and it does not involve pinching, zooming, typing, swiping, or otherwise handling overly sensitive glass.
Welcome back. Voice first technology is very accessible, as you just heard from Aging in Place Trends Watcher Lori Orloff. And certainly, we're increasingly using smart tech to remotely monitor patients. Dr. Reichman, what systems are actually in place at Baycrest?
Well, we have a variety of technologies. Some are market ready and some aren't. We have smart mattresses, smart flooring that tells us whether there's been a change in someone's gait or in their overall movement. We've been pilot testing smart commodes or toilets that can spot a change in that part of physiologic functioning that could betray a change in medical condition. We obviously have wander guard systems for people with cognitive impairment who can easily get lost or wander into the wrong room. We have robotics to help our care providers to transfer patients, as well as to provide prompts for people with memory problems. So there's a whole range of these technologies.
Yeah, actually, David, I was just going to ask about that. I've seen the very cute little robots that are actually in use in Japan. They're companions.
Companions. There are also robots that are programmed now for dealing with cognitive impairment, speech impairment. There are robots that can be programmed to replay memories and music specific to that individual to kind of relate to them. It's astonishing what's going on. We have brilliant technicians and researchers in the clinics, in the labs, in the research facilities, but we got the same old bureaucracy, I'm afraid, deploying it. And the deployment is a hot mess right now.
Andre, are you ready to be taken care of and kept company by a robot?
Well, I have seen that in Japan, and it is quite amazing. But I think, technology is important, but people are more important. Healthcare is a people business. It's about people. It's about listening to their needs and then creating the technologies to meet those needs. So it's really important that it not be top down. And I think there's a lot of top down now. Baycrest does some great research, but there has to be more patient input. There has to be more family input into this.
Okay, so here's the practical question that I have about this, and whoever, I suspect Bill Reichman will want to answer. So I'm not at that stage yet, and I have all my faculties, I think, and I use relatively simple technology, but it goes on the fritz at fairly regular intervals, and I have to get IT to fix it. So how is it going to work with people who have issues, cognitive issues, and are dealing with all this technology that, is not going to work perfectly all the time?
Well, look, Libby, we've gotten to a place where we can rely on our refrigerators keeping our food cold, and we can rely on our cars getting us to our destination reasonably safely most of the time. And so we will find the same thing with these seniors assistive technologies. The technology has to be a solution to a real problem. One of the issues we find in the innovation space is that a lot of entrepreneurs and innovators are introducing solutions in search of a problem.
Okay.
I think this gets to Andre's point. Let's first find out what people's needs are and then go out into the world and procure those solutions that best meet the needs. But the most promising technologies understand that they have to be usable. They have to respect the changes that occur as we get older in our vision, in our hearing, in our ability to touch and feel, to walk around. So the best technologies respect some of aging related changes and then are adapted to address those changes.
That people are using technology much more. Telehealth is prevalent now where it wasn't, 8-9 months ago. And it is really forcing people to, get the help from their kids and grandkids to get their phone set up and so they can talk to their occupational therapists or their physicians and so on. So I think that this pandemic, the silver lining in this cloud may be that people are really, they're opening up to the power that technology can have in their life.
CARP wants increased support for high-speed internet right across the country. We can't expect people to stay in their homes in rural communities if they don't have access to high-speed and these technologies and the expanded healthcare solutions that we now have and we know are working when people can use them.
Oh, I agree. So when we come back, final thoughts. Don't go away. Welcome back to theZoomer. It's time for final thoughts. We'll start with Bill Van Gorder.
CARP wants increased support for frontline home care, respite care, and community health care so that seniors can stay in their own home. And finally, we need to make sure that seniors know what's available to them and the proper navigation is there for them so that they and their families can make the decisions for what they need and not have someone making the decisions for them.
Andre.
Very briefly, I think it's about asking a very fundamental question. How do we want to live as we get older? And then creating a system to deliver on that. We know that the way we can live now is not the way we want to live, so we have to fix it from the bottom up.
Lesha.
So I just want to say that the UK has just approved a budget of $573 million for home modifications through their foundations organization. And I think that we need to really focus on making our environments a place where not only our seniors, but their caregivers can live safely and function well.
Bill Reichman.
We need to respect Einstein's axiom that the definition of insanity is doing the same thing over and over again and expecting a better outcome. And that's exactly what we've been doing in the senior care sector for the last 40 years.
Miranda.
Let's make home care a choice for people to stay in their homes and a choice for people to go into the field and work as personal support workers. Let's have more full-time hours. Let's have more access to public hours, and let's make it work. The digital future looks wonderful, but let's not forget that personal care and personal touch is mightily important to us humans.
David.
The vast majority of Canadians are not in long-term care homes. They're not even in retirement homes. They're living out their years badly or well at home. So home care is already the bedrock of any long-term care. And I think the solution here is to make home care and the home care plan, or the roadmap as you called it, make that a thing that people are aware of. They're aware that they don't have that roadmap yet. Let them go and try to create it badly or well, incompletely or completely, better next year, better the year after, better as more information gets added. But make it a thing that you're consciously trying to create for yourself right now.
Stakeholders, advocates, and government all seem to agree that home care has to be the pillar of a sustainable plan to take care of us as we age. We just have to make it happen. Thank you to my panelists for being here and to our audience for watching. For now, it's time to zoom out.